Access to healthcare is a crucial issue. It shouldn't depend on what we can afford or where we live. Dedicated to bringing about a compassionate society and sustainable world where all lives can reach their highest potential. Tatnan Tewi Trevanong Foundation incubates effective healthcare solutions with wide applications, especially in remote areas. Being located in Thailand, the center of the Greater Mekong region, where the malaria drug-resistant strains remain of high concern, to help protecting those living in the country's border provinces of Yala, Narathiwat, Songkhla, Tak, and Sisaket from the malaria threat. Tatnan Tewi Trevanong Foundation has therefore partnered with the Global Fund, who invests US $4 billion a year in more than 100 of the hardest-hit countries to defeat HIV, TB, and malaria. Apart from the support to Mahidol University's Shoklo Malaria Research Unit to stop malaria resurging, the foundation also assists preventative initiatives with public officials and health volunteers. These include training public health officers to educate and empower local people, teaching students and young people in high-risk areas so they can contribute to malaria preventative programs and further disseminate knowledge, improving community malaria clinics to better treat and control the epidemic. We also work with leading experts such as Francois Noston, Professor of Tropical Medicine and Director of the Shoklo Malaria Research Unit.
That is 35 years ago. Malaria was a big problem in Thailand, especially in the border between Cambodia and Thailand, in the south, in the north also. You still had malaria north of Chiang Mai, between Chiang Mai and Chiang Rai, and on Tak province also a lot of malaria. And the reason why it was like that, there are multiple reasons, but one of the reasons was the parasite that causes malaria was becoming very resistant to drugs, and so it was difficult to treat this malaria parasite. And if you look at the previous years before 1985, Thailand had made a lot of progresses against malaria, had reduced malaria a lot.
In recent years, joint action across all sectors and the empowerment of the public health volunteers have enabled early diagnosis for rapid treatment. Cases of malaria in the project area have decreased significantly. Infections in Narathiwat, Sisaket, Songkhla, Tak, and Yala provinces are down 51%, and the threat of malaria has reduced significantly. Tatnan Tewi Trevanong Foundation is committed to bringing about a compassionate society and sustainable world where all lives can reach their highest potential.